we're going to talk about the easiest, the cheapest, the most important mineral that's especially the most important for everybody here in the Midwest, particularly the Upper Midwest, and that is iodine. Now, a lot of people know iodine is super important for your thyroid health. Why? Because maybe you've heard of T3, T4, these are your thyroid hormones. The 3 and the 4 actually represent how many ions of iodine are bound to the hormone. You can't make thyroid hormone without a proper intake of iodine. Now, we're going to back up here. You know who has the highest rate of thyroid disease in the world? I'll give you a second to think about it. Yes, it's the Upper Midwest of America. Why? Why is that? Why do we have higher thyroid disease than anywhere else in the world? And not only thyroid disease, but ovarian disease and breast disease. Why is that? What's special about here? Well, we are as far as you can get from naturally sourced iodine. So where does iodine come from? It comes from seafood. And immediately, about half of you are saying, oh, I don't like seafood. Well, if you're around here, maybe it's because you've just never had good fresh stuff. Because here in the Upper Midwest, we don't get good fresh seafood. And because of that, we don't get iodine in the diet. Now, I mentioned ovaries and breast tissue as well. After the thyroid needs iodine, the next organ that needs the most iodine is going to be the breast tissue. And after that, ovarian tissue. And after that, skin tissue. So if you're sitting there thinking, gosh, my breasts are sore when I'm going through my cycle, or maybe they're just sore all the time, or maybe I have fibroids in my breasts, or maybe I have PCOS. Maybe I just have super painful periods in general. This could be iodine deficiency. And immediately, I hope you guys are picking up why so many women have thyroid problems more often than men. It's because men don't have breasts, and they don't have ovaries. For men, calcium and zinc is much more important, but we can talk about that later. We're talking about iodine. So, who has the lowest rates of breast disease, of thyroid disease, of ovarian disease, and is without a doubt, by a long margin, the coastal Japanese people? Why? Well, it's because they're eating seafood all day, every day. The average coastal Japanese gets an intake of 12.8 milligrams, not micrograms, milligrams of iodine every single day. You know what the average Midwesterner gets? 300 micrograms, which means we Midwesterners only get 2 to 3% the iodine we need to have healthy thyroid, breast, and ovary tissue. Now here's the good thing about iodine. It's cheap. It's super cheap. You can go to Walmart and get potassium iodide for pennies. Now, if you want really good iodine, it needs to be bound to protein. That's what I have here in my office. But we need to increase that intake to 12 milligrams a day, just like the coastal Japanese. I have spoken with so many patients who have both thyroid and breast disease, and their physicians never told them, hey, make sure you're taking enough iodine because it's super important to the health of these tissues. So we gotta be getting on that iodine. And anybody who's taken any thyroid medication should be taking iodine with it. And it drives me insane that there is not iodine included in every single medication that's given to the thyroid patient.